Welcome back to the King's Podcast, the Wellness Dive with Lucky. I'm your host, Esther Lackie. Today we are joined by Dr. Ali Razzak, consultant family medicine. And since it's November, or Movember, should I say, Dr. Ali here has a special interest in men's health, sexual health, and mental health, among other specialties. Today we'll be discussing with him, taking a deep dive into men's health. And if you're a man, you know you hate going to see the doctor. So Dr. Ali is here to tell you why you should see your family medicine doctor on a routine basis. Doctor, thank you for joining us today. You look really sharp, I might add.
Thank you very much for having me. As always, Esther, it's a pleasure to be here.
So, tell us, what is Movember about? We always hear Movember, mustaches here and there. What is it all about?
Yeah, so the essence of Movember is actually really quite simple. It's about raising awareness of the issues that affect men's physical as well as their mental health. It's ultimately about empowering men to live healthier, longer, and happier lives. And there's an interesting story actually behind the whole Movember campaign or foundation. So you might have seen people grow these funny comedy mustaches for the month of November. Well, it all started back in 2003 when you had two friends out in Melbourne, Australia, and they were actually looking at how to bring the mustache back into fashion, or the mo, as they call it over there. And they thought, well, why don't we actually do it for charity? And the charity at the time that they chose was research into prostate cancer. Since then, for the last 20 years, it's grown into the biggest men's health charity worldwide, raising millions every year for research and for good causes to help improve the quality and the length of men's lives. And we wear this mustache as a badge of honor in the same way that our female colleagues wear the pink ribbon for Breast Cancer Awareness Month. So for far too long, too many men have died too early. And really, it's about increasing the awareness of the issues that affect our gender specifically.
So, talking about proudly wearing a mustache, are you going to shave yours and let it grow during the whole of November?
I'm still thinking about that one. It's I'm not sure if I'm brave enough to go to kind of don that look just yet, but let's see. You might be surprised.
Good. Looking forward to that. So, a number of surveys have shown that men are half as likely as women to voluntarily go see a doctor. And when they do, they kind of take it casually. Why is this? As a man, you can speak from a man's point of view, and as a doctor.
Yeah. Yeah, it's a very good point. So there are lots of studies that show that there is a major disparity between the health-seeking behaviors between men and women when it comes to their health. It's even more marked and noticeable when it comes to mental health as well. And what that actually results in is, unfortunately, misdiagnoses and ultimately men dying earlier and living with illness for longer. So really, that's the whole point of kind of Movember, is about increasing the awareness of these issues. And the question is why? So why are men so stubborn? What is wrong with them?
Exactly.
Is it out of pride? Is it out of something else?
I mean, I've heard some men say, why fix it if it ain't broken? What is that all about?
The issue is this: so many men have, they are related to concepts of masculinity. So men have this macho attitude whereby they're strong and they shouldn't show weakness or emotion. Therefore, they going to the doctor is seen as a vulnerability. Many men are also quite nervous of the possible diagnosis that might be underlying. And at least 20% of men avoid going to the doctors because they're worried that there's something actually quite wrong. And actually, as a result of that, that's not really a very good idea. If you think something's wrong, the worst thing you can do is actually not do anything about it. And then you've got men who just don't like the idea of being examined.
Getting prodded and
Well, exactly, and it goes back to that notion of sort of masculinity. And so, particularly when it comes to private exams or intimate examinations, they may feel very vulnerable, and for these reasons, men are much less likely to go see a doctor. In fact, 40% of men only go and see a doctor when things become really quite bad. So that's a tipping point.
yeah. Speaking of that, I'm sure in your career you've seen men who have come to see you when things are really good and bad. Not that they want any symptoms, they were. So, what are the most interesting excuses you've heard from such men?
Yeah, no, there's always excuses. So, we're very good at just kicking that can down the road and really trying to avoid going to see the doctor and actually just talking to people when there's a problem. Some of the excuses I've heard are, oh, it's really embarrassing. Okay, so well, I'll tell you now, as a doctor, there's really very little that we haven't seen. So, absolutely, you should not be shy or embarrassed about any of these sorts of issues. Another sort of excuse I hear is, I don't want to waste your time. Well, newsflash, it's my actual job to look after you.
This is my
So
job. If you don't come to me, I don't have a job.
absolutely. So you're not wasting anybody's time. It's in fact, I really encourage people to come and see them. And then you've got more serious kind of excuses. So, I remember people saying things like, I didn't come and see you because I thought it was cancer.
Oh.
So, that whole statement just doesn't even make any sense. So, by ignoring something like that, it's very unlikely it's going to get better by itself. So
Right.
please do come down.
Please, gentlemen, go see your doctors. Please, please, please. Okay. So Movember shines a spotlight on prostate cancer, testicular cancer, and mental health. What moving away from that, what are the top conditions that affect men?
Yeah, so like you said, the Movember focuses on those three conditions. But if we're looking at in terms of overall mortality or the reasons why men die, the number one killer is actually heart disease. So in fact, 25% or a quarter of all men die from heart-related causes. And these can be, heart attacks, heart failures, and all the conditions that are related to them. So things like high blood pressure, high cholesterol, diabetes. And the sad thing is that actually 50% of men who die from a heart attack, they have no preceding symptoms. So people might be walking around for a very long time thinking they're absolutely fine, and then suddenly they'll just drop dead.
Wow.
So that's really the whole point of trying to do, awareness, increase awareness for November for these sorts of issues. So that's heart disease. The next kind of big killer after that would be all the cancers that affect the men. So obviously the common cancers are, if we look at it by age group, so for younger people, for men between the ages of 15 and 44, the top cancer is testicular cancer. Then you've got for older men, it tends to be prostate cancer. So 60, 65 plus would be that. Then you've got other conditions like lung cancer, colorectal cancers, and other less common cancers as well. Other common things that take men's lives down the list would be actually incidents and accidents. So that's the third biggest killer of men, in fact. And actually, for men under the age of 45, it's actually the biggest killer. So these are your road traffic accidents, falls, accidental overdoses, these sorts of things. Again, a lot of the time, these things can be preventable. Unfortunately, with men, we do take risks more than our female counterparts, and it leads to not very good places sometimes, unfortunately.
Yeah, yeah, yeah. So I've known you for what, 3, 4 years now?
I think so. Yeah.
Yeah. So I know you're a big supporter of mental health wellness. So when it comes to mental health challenges, how prevalent is this among men?
Yeah, so mental health issues amongst men are actually a lot more prevalent than people think, and it's largely because of men just don't like talking about it. So if we look at some statistics, I mean, a very sad one that I always try and quote is every minute of every day, a man takes his own life as a result of depression. And the sad thing is with mental health is that unlike physical health, mental health is much more preventable and avoidable. And actually, there are many sort of telltale signs for men when they're going through a rough time. So whereas a woman might present, if she's depressed, it can be very clear, it's very easy sometimes to see if a woman feels a certain way. So she'll be tearful, she'll be very sad. You can just see it on her face. Whereas for a man, they may just behave differently. So they might not look sad, but they'll be very aggressive. They'll be taking more risks. They might have more substance sort of addiction and abuse. So these are the sorts of things that may tell you that something's wrong. And in fact, about 1 in 8 men at some point in their lives has a depressive episode. as opposed to 1 in 4 women. So, however, 3 out of every 4 suicides are done by men. So what that tells us is men generally are slightly less likely or half as likely to become depressed as a woman. However, if they do, there's a much higher chance that they'll unfortunately do something uh, fatal or be a lot more severe in that situation. So really, if you or any of your loved ones out there, if you have concerns about them, please do get in contact with your doctor, with your friends.
And then we're in Dubai. It's a transient city. Some men live alone, they live by themselves. So how can they recognize that they have a problem and they need to see a doctor if there is nobody else, looking at them to notice these kind of symptoms or the changes?
Yeah,
How,
it's a good point. I mean, you're right. Dubai can be, although it's a lovely, vibrant, cosmopolitan city with people from all over the world, it can be a very lonely place as well at the same time. And a lot of people come here actually by themselves. They're not with
yeah.
their families. Um, if you as an individual, as a man, if you feel that something's just not quite right, even if you can't put your finger on it, but you just know that you're waking up every day, you're really tired, you lack motivation, you lack concentration, you don't enjoy the things that you used to do, whatever they may be. That is a telltale sign. And if you have a friend that you've maybe dropped out of contact with, and you're concerned about, then just give them a call. Just check in on them. Just check in on your bros. That would be my message to you.
Movember, check in on
That's
your
right.
friends. Don't let them be lonely.
Absolutely.
Okay, back to not why you should fix it if it's not broke. So I have to ask you because I know you do preventative health checks. How important are these, and how do you encourage somebody to just walk into your clinic? They're not presenting any symptoms at all, just to come and say, "Hey, doc, I'm just here to find out if I have any issues with myself, with my body, with my brain."
Yeah, so look, there's a very famous saying, prevention is better than cure, and I'm
Mm-hmm.
an absolute believer in that. I mean, it's all well and good to try and fix something once it's broken, but as we already discussed with with heart disease, for example, 50% of people will drop dead before, and they won't have any actual preceding symptoms. So, and a lot of the time, the issues that cause heart problems are actually, that you may not have any symptoms.
Mm-hmm.
So, for example, high blood pressure is one of the major causes of heart disease, and we call that the silent killer. So, just like an assassin in the background, you don't know that they're there. It's the same thing with high blood pressure. It's there causing illness, it's damaging your organs, your heart, your brain, your eyes, your kidneys, causing all those problems. It's the same thing with cholesterol as well. So it's not about waiting until it's broken until you fix it. It's actually about seeing if there's something that might be amiss before it actually becomes a problem.
A friend was telling me the other day that men would stick to the calendar of taking their cars for service. But if you tell them to get checked, they will argue to the ends of the earth and refuse to do it.
Absolutely. I mean, as men, we take pride in our cars. We'll make sure they get serviced and they'll have their MOTs every year.
Mhm.
So why don't do the same thing for yourself?
Yeah, exactly.
You'll thank yourself, later for taking care of yourself today.
So you just spoke about heart disease. So somebody can actually be looking all healthy, no symptoms at all, but with the health checks, specifically heart health checks. You can, if they're done, they can find some symptoms of sorts or some problems.
Yeah, so what would happen in a health check, for example, is you'd come in and see a doctor like myself or one of my colleagues, and we'd take a history. We'd look at your risk factors. So we'd look if you're a smoker, if you've got a family history of heart problems. We'll take some measurements as well. So we'll do blood tests for things like your cholesterol, your sugar, screening for other sorts of issues, and then we'd refer you on to see our cardiologist as part of that checkup. And what we do in that situation is get you to run on a treadmill so we see what your heart looks like under duress or under stress. And based on that, there are certain changes that we can see, and that gives us actually a fairly accurate picture
Mm-hmm.
of what your overall risk might be of having a heart problem. And of course, if anything is identified, then we'll either try and manage that with medications or with lifestyle advice or referring you on to a specialist or a combination of all of the above.
All right. Doc, at King's we have several health check packages. Now let's discuss the basic one. What does it include and how long does it take so that if a person really wants to have a health check, they know how many hours or minutes to back away from their daily routine?
Yeah, so we've got a range of health executive screening packages. If you're looking at the the standard one that you're talking about, is we just do a series of blood tests for that. We do an ECG, we do a physical examination. That really doesn't take very long. It probably doesn't take more than half an hour to do. If we're going to do the other stuff with the cardiology and other aspects as well, where they may need X-rays and ultrasounds, that's probably a 3 to 4 hour affair. So I'd set aside, half a day in your calendar, which I'm sure most people could
Half a day.
could find for that. Yeah, absolutely.
Wow. Have you had any of the health checks yourself?
I have actually, I have, and I'm here every day, giving advice to my patients. And I thought to myself, well, when's the last time I did a checkup myself? And in fact, I went down to see the cardiologist here at the hospital, and I checked my cholesterol and actually found it to be pretty high. So as a result of that, I've started taking a cholesterol tablet myself. Um, so it's something that really, and I had absolutely no symptoms. So that's why, I'm a real, advocate of these things, because I'd only ever do something that I'd recommend for myself, for other people as well. And these things, they do creep up on you.
Yeah.
So it's really important to go get yourself checked out. I think even if you feel fine and you've got no symptoms and you feel great, at least you can get a bit of peace of mind. And at worst, we might actually pick something up that may help save your life, or at least give you a longer life and a healthier life.
Awesome, Doc. Look at you. Preaching water and drinking the water.
That's it. You've got to practice what you preach.
To finish off, what do you have to tell your bros about men's health?
Yeah, look, I'd say to all my bros out there, it's, take this opportunity, take Movember as a time where you should go and look after yourself, put yourself first, stop making excuses, swallow your pride a little bit, go and see your doctor, talk to them, have that MOT, have that checkup. You may, it may save your life, or at the very least, it will give you a bit of peace of mind. And I'd also say to not just for the men, but for the women who've got brothers and sons and husbands and fathers who they love, um, you know, if you're concerned about them for whatever reason, studies show that if you nag them, at least 20% of men come to see their doctor because the loved ones nag them. Okay, so nagging actually works. So I'm giving you permission to go out there and nag your loved ones, to get them to come in and get
You're
that
taking a
checkup.
risk, Doc.
I know, but it's a risk I'd like to
When
take.
you get back to the
It's worth it.
clinic, you will just find a line of 100 men looking to
If we can do
have a
anything to
chat
help,
with you.
yeah, we're there to help.
All right, Doctor. It was so amazing having you here, and we look forward to having you again.
Thank you very much. It's my pleasure being here.
Dr. Ali Razzak, consultant family medicine, special interest in men's health, mental health, and sexual health. You can find him at King's Dubai Marina, just opposite Spanish. Until next time,